This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello, and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today we're looking at a fascinating new study from the journal Interventional Neuroradiology titled Device Use Trends in Neuroendovascular Procedures in the United States from 2015 to 2020.
This is a timely piece of research, Alara. As those of us in the OR and the angio suite know, neuroendovascular therapies involve an ever-changing landscape of new technologies. It feels like every year we have a new iteration of a stent or a microcatheter. But what this paper by Adapa and colleagues really gets at is the real-world timeframe of adaptation.
Exactly. It's one thing for a device to be FDA approved. It's another for it to become the mainstay of therapy. The authors wanted to understand how long it actually takes for these proven therapies to achieve widespread use. They used device sales as a proxy for procedural volume, which is a clever way to bypass some of the delays you get with traditional coding data.
Right, because purchase orders don't lie. Let's talk about their methodology for a second. They looked at a device sales data registry from the Decision Resources Group.
Yes, they examined trends in sales for devices used in cerebral vascular thrombectomy, cerebral aneurysm treatment, and carotid stenting. The data came from the same 407 reporting hospitals in the United States. They tracked this from January 1st, 2015 to January 1st, 2020.
And I think it's important to note for our listeners that they purposefully stopped at January 2020. They wanted pre-COVID-19 era data so they wouldn't confound the results with the collateral impact of the pandemic.
That's a crucial distinction. They used the Cochrane-Armitage test for trend to compare devices, and they analyzed the data using RStudio. They weren't just looking at total numbers, but also at the percent of total device sales when compared against other devices.
So let's dive into the results. Let's start with aneurysms. That's where we saw some of the most dramatic shifts, wouldn't you say?
Absolutely. Between 2015 and 2020, there was a linear growth in the number of flow-diverting stents used. To put some numbers on it, in Q1 of 2015, there were 131 flow-diverting stents used across those 407 hospitals. By Q4 of 2019, that number jumped to 430.
That is a 328% increase. That's massive. It reflects the shift in how we approach wide-neck aneurysms that were previously deemed difficult to treat via an endovascular approach. But what I found interesting was that this growth in flow diversion didn't actually kill off the use of non-diverting stents used for coil assistance.
You're right. In Q1 of 2015, there were 215 non-diverting stents for coil assistance, and by Q4 of 2019, there were 389. That's still a 152% increase. So we are stenting more across the board, whether it's to divert flow or just to keep coils in place.
However, the old reliable, the coil itself, is seeing a relative decline.
It is. The paper shows that the rise of flow-diverting stents has resulted in a decline in coils used for neuroendovascular procedures. When you look at the percent of device sales for aneurysm treatment, coils represented 91.1% of the market in early 2015. By late 2019, they were down to 83.9%.
It makes sense. If you're placing a flow diverter, you're often not using coils at all, or you're using significantly fewer. As a senior attending, I remember when coiling was the absolute standard of care for almost everything after the landmark trials. Seeing it drop by nearly 8% in market share in just 5 years is a significant shift in practice patterns.
The paper mentions that technological advancements like low-profile intracranial stents and intrasaccular embolization devices have really pushed this evolution toward more minimally invasive treatments for patient comfort and safety.
Now, let's move to the second big category, mechanical thrombectomy, or MT, for acute ischemic stroke. This is a field that has exploded since the 2015 landmark trials.
It really has. The study looked at the two main schools of thought, stent retrievers and aspiration catheters. They found an overall trend of increased use for both. In Q1 of 2015, these 407 hospitals used 400 aspiration catheters and 466 stent retrievers.
And where did those numbers end up by the end of 2019?
They surged. By Q4 of 2019, we're looking at 1,432 aspiration catheters and 1,478 stent retrievers. It's almost a perfect parallel growth.
That's interesting because there's always been a debate in the literature, the ADAPT technique, or direct aspiration first pass technique, versus the traditional stent retriever approach. The paper notes that ADAPT has been shown to be at least as effective as retrievable stents. Looking at these numbers, it seems the market is split almost exactly 50-50.
Exactly. It's not that one is replacing the other. Rather, the total volume of mechanical thrombectomy is increasing so rapidly that both technologies are rising together, though the authors did note that the use of these reperfusion devices plateaued in 2020.
That plateau is worth investigating in future studies. It could be a saturation of the market or perhaps a stabilization of the systems of care for stroke. We also can't ignore the third category they tracked, carotid stenting, or CAS.
Right. The authors mentioned the CREST trial and the ACST2 trial as the background here. CREST showed equivalent composite outcomes between carotid endarterectomy, or CEA, and carotid stenting, or CAS, for standard-risk patients. ACST2 showed similar efficacy in asymptomatic patients with moderate to severe stenosis.
And the data from the 407 hospitals reflects that clinical evidence. The number of stents used for carotid procedures has been gradually increasing over time.
It's a slower, more steady climb compared to the explosion we saw in stroke and flow diversion, but the trend is clearly upward.
So if we step back and look at the big picture of this paper, what are the authors telling us?
The conclusion is quite clear. Between 2015 and 2020, there was a significant increase in the use of flow-diverting stents, non-diverting stents, carotid stents, and reperfusion devices for AIS intervention. Meanwhile, coil use for aneurysmal treatment has declined.
It's a transition from filling the space with coils to remodeling the lumen with stents and removing the clot with high-volume devices. This study provides a vital real-world baseline for how we adopt technology.
It also highlights the importance of these registries. By using purchase order data, they avoid the pitfalls of subjective reporting.
For our residents and students listening, this is the landscape you are entering. It's a field where the standard of care can shift by 10 or 20% in just a few years based on the arrival of better, lower profile, or more effective hardware.
And as the paper suggests, understanding these timeframes of adaptation could help us find mechanisms to shorten the duration necessary for the widespread use of proven therapies. If we know it takes 5 years for a 300% increase in a device like a flow diverter, how do we make sure the next life-saving device reaches everyone even faster?
Well said, Alara. This study is a great reminder that neurosurgery is as much about the tools we use as the hands that use them. Any final thoughts on the paper?
Just that it's a great example of using big data from a healthcare research and consulting company like the Decision Resources Group to answer clinical questions that traditional hospital records may miss.
Agreed. Well, that's all the time we have for today's deep dive. I want to thank Dr. Alara for joining me to break down these trends.
My pleasure, Dr. Aris. It's a fascinating time to be in the field.
This has been the Neurosurgery Hub podcast. Stay tuned for our next episode where we continue to explore the cutting edge of our specialty. I'm Dr. Aris.
And I'm Dr. Alara. We'll see you next time.